If you struggle with extra gas and the discomfort it brings, Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone can help. This medication is designed to ease symptoms like belching, bloating, and stomach pressure. Simethicone, the active ingredient, works by breaking up gas bubbles in the gut. Be sure to check the ingredients on the label, as they may have changed since your last purchase. Also, be mindful of similar products with different ingredients, as using the wrong one could be harmful. As for dosage, it's best to follow the instructions on the packaging or as directed by your healthcare provider. You can take this medication as needed, typically after meals and at bedtime. When taking Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone, it's important to follow all directions on the product package or as prescribed by your doctor. Take this medication by mouth, usually as needed after meals and at bedtime. The dosage will be determined based on your age, medical condition, and response to treatment. It's crucial not to increase your dose or take this product more often than directed. If you are using the chewable tablets, make sure to chew each tablet well and swallow. If your condition persists or worsens, or if you suspect a serious medical problem, seek medical help immediately. If you experience any unusual effects from using Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone, it's important to contact your doctor or pharmacist right away. Your doctor has determined that the benefits of using this product outweigh the potential risks of side effects. Most people who use this product do not experience any serious side effects. Although it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for further guidance. As for the best time to take this medication, follow your doctor's instructions and dosage recommendations for the most effective relief from gas. Before taking Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to consult your pharmacist for more details. If you have any health conditions, it's essential to consult your doctor or pharmacist before using this product. Chewable tablets may contain sugar and/or aspartame, so if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances, it's important to discuss with your doctor or pharmacist about using this product safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this product. However, Simethicone is unlikely to harm a nursing infant as it does not pass into breast milk. It's always best to consult your doctor before breastfeeding. When taking Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone, it's important to be aware of potential drug interactions. These interactions could affect how your other medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If you take thyroid medication, be mindful that Simethicone can decrease the absorption of thyroid medications, such as levothyroxine. To avoid any potential interaction, it's recommended to take thyroid medication at least 4 hours before or after products that contain Simethicone. This will ensure that both medications can be effectively absorbed and work as intended. If someone has taken too much Mg Gas Relief, Simethicone, 80 mg Chewable Tablet Simethicone and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important to keep all medical and lab appointments. If you have issues with gas, you may find it helpful to avoid foods that are known to cause gas and bloating, such as beans, cabbage, and high-fat foods. You can also consider using digestive enzymes. If you need help with your diet, it's a good idea to consult with your doctor or a dietitian. Belching can be caused by swallowing too much air. Eating or drinking quickly, chewing gum, and smoking can all lead to swallowing more air. If you forget to take this medication on a regular schedule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose. Do not take a double dose to make up for the missed one. Remember to take your next dose at the regular time. It's important to store Mg acid gas relief, Simethicone, 80 mg chewable tablet Simethicone at room temperature, away from light and moisture. Make sure not to store it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.